Hi, I'm Tammy.
And I'm Leanne. We are nurses who work in the Brachytherapy program at the London Regional Cancer Program. We work to help schedule patients for their procedure, see patients ahead of their procedure for one-on-one teaching, participate as part of the brachytherapy team during the procedure, and follow up with patients after the procedure.
In this video, we'll talk a little bit about what you can expect after your brachytherapy procedure has been completed. You will typically spend an hour or so in our recovery area at the London Regional Cancer Program, and then an additional hour or so in the post-operative perioperative care unit in the main hospital. During recovery, you will be slowly waking up from the anesthetic. Nurses will be monitoring your vital signs, and medication is available if you are having pain or feeling sick to your stomach. You will be able to start drinking fluids and eating as soon as you are feeling up to it. Once you are drinking fluids, the IV line will be removed. The nurses will also monitor the urine coming from your catheter. It is common to have a feeling like you want to urinate with the catheter in place, and to have some blood in the urine for an hour or two after the procedure.
Some patients may have a bit more bleeding than usual in their urine. If this happens, the nurse will rinse out the bladder with some additional water through the catheter, a process called continuous bladder irrigation, or CBI. Once it looks like the urine is clear of blood, the catheter can be removed. Your nurse will ask you to try to go to the bathroom and empty your bladder on your own before leaving the hospital. If you have had a low-dose rate brachytherapy procedure done, a radiation safety officer will come with a radiation monitor machine to do a reading on you during the time in recovery. Patients can be discharged once they are drinking well and their healthcare team determine that they are well enough to leave. After discharge, you should be sure to follow instructions for any medications you've been prescribed and follow any radiation precautions discussed with you.
If you receive low-dose rate brachytherapy, we will arrange for you to return in about 4 weeks to have an MRI and a CT scan of your prostate as a final quality check for implanted seeds. This allows us to do a final dose calculation to make sure that the dose of radiation in the prostate is acceptable. If you receive high-dose rate brachytherapy, we will typically arrange for you to return within a week for a CT scan to plan the external beam X-ray portion of your radiation treatment. These treatments will typically be started within 2 weeks after the implant. After all your radiation treatments are finished, you will have a follow-up appointment to see your radiation oncologist. During this appointment, you will discuss any side effects you may be experiencing from the treatment. You will also have regular PSA blood tests to monitor the effectiveness of the treatment.
In the early days to weeks after brachytherapy, it is common for patients to be tired and to experience symptoms of bladder irritation like urgency of urination, frequency, burning, or getting up at night to urinate. These symptoms do settle over time and rarely last longer than a few months after treatment. Medications and changes to your diet can often help manage these side effects, and your radiation oncologists and nurses will help work with you to manage your side effects. In some cases, the benefits of the treatment can take months to show up on your PSA tests, as your PSA often goes down slowly after treatment. Your radiation oncologist will work with your urologist and family doctor to coordinate your follow-up care and any ongoing treatment like hormone therapy that may be part of your care.
We hope this information has been helpful, and we thank you for taking the time to watch these short videos on our prostate brachytherapy treatment.